So, hi, Anke.
Hi.
It's such a pleasure to get to do this interview with you, and I know you have so much knowledge and wisdom to share, but also you have such a big heart and such a commitment to people's health. So I'm really excited to do this interview myself and to learn from you. So maybe we can start by just having you tell us a little bit about you and the work you do.
Okay. So thank you. First of all, thank you for inviting me to do the interview and for the collaboration. It's an honor. I work as a clinical hematologist in a university hospital in Belgium, which means that my daily activities include taking care of patients both on the ward and in the consultation, mainly focused on patients with acute leukemia and undergoing stem cell transplantation. So it's a very intensive care plan and very intensive treatment that they have to go through. So that's mainly my daily life job wise.
Amazing. And I know that you have a very big commitment and interest in a holistic approach to cancer treatment and recovery. Can you tell us a little bit about that?
Well, that was actually triggered mostly by the patients themselves because they ask a lot of questions when confronted with the diagnosis of cancer. They ask a lot of questions about what can I do? Is there something I can eat? Is there something I can do differently? And they don't teach us the answer to that question in medical school. Like most of my colleagues just brush it off with, yeah, maybe you should just eat healthy, or there's nothing you can do, but I had a feeling that the answer should be different. So that was the first trigger to go look for answers. And the second trigger was my own son, who was born with a cardiac condition 5 years ago, which made me feel completely out of control, loss of control, because I was supposed to be the doctor, knowing everything that had to be done, but all of a sudden I was his mommy and I was not a doctor. So when I was sitting next to him in the hospital, I was thinking, what can I do? So all of a sudden I was confronted with that same question, like I want to have control, I want to know what to do to make things better. And I turned inwards, I guess, and then decided that, like, if I can be the best version of me, then I can help my family through this, and I can show him how to be healthy so he has a better chance at staying healthy as he grows up. So that, like, both those triggers made me look into food, look into lifestyle, exercise, and look into all these things and what they can do for people that have a disease, even if it's heart disease or cancer. But of course, my focus went to cancer because that's where I work. So that's kind of how I got into this. I started experimenting for myself and also reading a lot of the literature that is out there.
Nice. And I know there's probably a lot that you could say about this, but maybe you can summarize a little bit. What is the relationship between health and lifestyle? I know there's a statistic that I've heard thrown around, which is that only 20 to 30% of your health is determined by genetics, and the other 70 to 80% is determined by lifestyle. Is that so? What would you say?
I think it's around about that number should be correct. What the strange thing is that even though they don't teach us anything about lifestyle or diet in medical school, or rarely anything. But on the other hand, 50 to 80% of chronic diseases are diet related. So we're thinking about heart disease, we're thinking about dementia, we're thinking about obesity, diabetes, and even cancer. Because also in cancer, we know that 5 to 10% maybe are genetic, and all 90 other percent are lifestyle related, so environment related. And that can be tobacco, that can be alcohol, that can be pollution. But a big part of it is actually diet and obesity. They're almost like 50% of cancers are related to diet and obesity. So those are the numbers, the facts. How exactly it is related, I guess that's still a black box for most of the part. There's a lot of correlations, like we know that there are correlations between what you eat and certain cancers. But there's not like one magic bullet, like do this and you don't get cancer. It's a combination of several factors.
Right. Those are some really big numbers. I didn't actually know that it was
Mhm.
that much. Um, so then the next question that comes up is, what are the main components of a healthy lifestyle? So you've mentioned diet, and that
Mhm.
sounds like it's one big component.
Of
What
course.
are other ones?
I think diet is probably number one. Um, Sleep and stress management are very important. They have an important um, effect on our immune system, and we all know the immune system probably plays a big role in the development of cancer and other diseases. So sleep and stress management definitely, and of course, yeah, exercise or movement. It doesn't even have to be heavy exercise, but intentional movement is also definitely very important. So I think those are the main, and then of course avoiding toxic influences, but all of that within what we can change, what we can take responsibility for. We cannot take responsibility for the pollution that's outside, of course, but we can take responsibility for trying to choose foods that are less toxic and for maybe trying to stop smoking and stuff like that.
Exactly. We need to focus on the things that we can
Things that we can
control
do,
and can influence, and
definitely.
let go of the other ones.
Mhm.
And it's my understanding that diet can also have an effect on sleep and stress management. Is that
Definitely,
right?
definitely. They're all interconnected, and probably the black box that interconnects them all is our gut microbiome, or the bacteria that live in our gut. A funny detail is that actually, if you put them on a scale, the bacteria in your gut and your brain are actually the same weight around and
Wow,
about. So there's the same amount of stuff in your gut that there's in your brain.
interesting.
And these bacteria have an effect on our immune system. So they they they're not just sitting there, but they give messages to our body. And through our food, we influence those bacteria, and then they give different messages to our body. And actually, it has an effect on everything. The gut microbiome also has an effect on your sleep, and it has an effect on how your brain functions. So actually,
Mhm.
people with dementia have seen improvement because of their diet. When they change their diet, the dementia sometimes improves. So there's a lot of links, and probably the black box linking it all up is the gut microbiome, but that's research that's still in early stages. Like these past years, there's been an explosion of research in that area, but we definitely don't know all the details yet.
Interesting. And a lot of people, not everybody, but a lot of people know what healthy food is and what isn't healthy food. And yet it's not always that easy to make the healthy choices.
No, definitely not.
What do you think are the challenges? What is it that gets in the way? And especially for cancer patients or people in remission?
I think there's several things. Well, first of all, there's a lot of information. We all somehow kind of know what to do, but still, if you go on the internet, you find a lot of different diets and a lot of different ideas of what is healthy, what is not healthy. And what makes it even more confusing is that patients who had cancer often have lost a lot of weight and they need to gain weight. So everybody's just telling them eat a lot and eat cookies and cakes. You just need to gain weight. But maybe that's not what their body needs at that point in time. It doesn't need cookies and cake. Maybe it needs more functional foods. So there's also the psychological part. Like
Mhm.
I went through cancer treatment. I'm allowed to enjoy this now. I'm allowed to enjoy life now. I went through all that. I deserve to have a cookie or this or that.
Right.
That also plays a big role. So we need to find a way, a healthy way to gain weight after cancer treatment, because
Yeah.
with healthy foods, we could probably improve the recovery, make it quicker, make it better, maybe have better cognitive function, because that's also something that a lot of cancer patients talk about after chemo, that they have more trouble concentrating on stuff. that they have trouble sleeping, for example. If we can improve all that, then their physical recovery will also go quicker, and their chance of recurrence of the cancer will probably go down, because we know that a lot of these things are diet related. There are studies saying that people who are obese have a bigger risk of cancer recurrence. Mm-hmm. So these are all correlations that tell us that probably a healthy lifestyle can improve the recovery and decrease their chances of relapse.
Mm-hmm. That makes a lot of sense. And I often say things can be common sense, but they're not common practice.
Yeah.
So, so I know that there are ways to make it into common practice, and we're going to be talking about that in a little bit. But first, I wanted to ask you a few other questions. So you mentioned that there's a lot of information online, and often there's a lot of misinformation and even contradictory information. Mm-hmm. And one of the things that I've heard is often recommended to cancer patients and people in remission is to go on an alkaline diet, mm-hmm. which means cutting out things like coffee, alcohol, red meats, among other things. What would you say about that advice?
I think the alkaline diet, it's better than a regular diet probably already, so that you're taking out a lot of toxic stuff. But maybe we should not push a certain diet, but maybe we should push more for a lifestyle. A diet is always seen as a short-term solution to get to a certain achievement you want to be. Whereas a lifestyle, it's a long-term improvement of the way you live. And there's enough to be said that the closer we go to our own human diet, the diet that we used to eat so many years ago when we were hunter-gatherers, which means a plant-based diet with some meat here and there if we were able to shoot an animal. So that would probably be better for us. And that would be more of a lifestyle, instead of saying you have to go with this diet or this diet and then you stick with it for so many weeks and then it's over. No, we should go for a permanent lifestyle change. And the best way to introduce a lifestyle change is when you really understand why it is, so you get the right information. Mm-hmm. And when you are helped in easing into that lifestyle, and when you feel the effects on your body, because when you really listen to your body, you understand, like, okay, this makes me feel good, so this is probably what I should do. So I guess it's a combination of the right information and the right understanding and feeling how your body responds when you eliminate certain things out of your diet.
Mm-hmm. So developing that self-awareness and that ability to connect with your body, to be able to identify what feels right and what doesn't feel right, is key. Is that something that you find people in remission can do and could benefit from doing after they've already been going through so many treatments and are maybe disconnected from their body for good reasons? What's your experience with that?
I think they probably are disconnected from their body because their body has gone through a lot of chemo and probably also a lot of antibiotics. So their body is completely changed. So I think it's definitely of value that after a treatment like that, they take time to reconnect with themselves, with their body and with their mind. So food is a part of it. Mindfulness, for example, can also be a part of it, because they need to realign, and probably their whole psychology has changed after an experience that they just had. So they definitely need to be able to take time for themselves and to realign with their body and their mind.
I love how you put that. That's such a good point. Now, you work at the University Hospital of Antwerp. Am I saying that right?
Correct.
In Belgium. Mm-hmm. And now, forgive me for what I'm about to say, but my idea of people in Belgium is that they are already pretty healthy in terms of their lifestyle in comparison to the average North American. Is that
Mhm.
true or is that a stereotype?
I think there's a big part of stereotype in there. I think North America, or at least the United States, are probably a little bit worse than we are. I don't like putting it in that category, but I think in large part it's a stereotype, and in our Europe as well, we're seeing more and more obesity. Honestly, the past 6 months, I've seen so many patients come in with acute leukemia that I found it frightening.
Wow.
And it's not just our hospital. Actually, we had a meeting last weekend from all the Belgian hematology centers together, and I asked a lot of my colleagues in other cities, and they're seeing the same thing. The past
Oh,
year, we've
wow.
all seen a rise. So, which makes you wonder what's happening with the world, and which makes me a little bit angry or disappointed. Like, why is this happening? And this might, this could have been prevented. Maybe I'm not saying all cancers can be prevented, but I think if everybody would take on a healthier lifestyle, probably a large part of them might not happen. So it definitely inspired me to move on with this work on lifestyle and cancer.
Yeah. And are you also seeing cases with younger and younger people as well?
Unfortunately, yes. Yeah.
Yeah.
30 year
Um, Sorry, say that again.
30-year-olds. I don't treat children myself. I start at 16, so I have treated young patients from the ages 16 onwards. But
Hmm.
we see a lot of people in their 30s, so they're
Hmm.
still very young. Yeah.
Wow. And I mean, I have so many questions related to that. And maybe we won't have time for all of my questions today, but I do want to ask you one, which is, and I'm not quite sure how to frame it. I feel, and I think you probably think the same as I do, that it's important not to have people feel that it's their fault that they've
Mhm.
gotten cancer, right? Or that
Mhm.
they've gotten an illness. And yet we're saying that lifestyle is a big influencer.
Mhm.
So is there someone at fault? Is there somewhere where the blame can be placed?
I think, first of all, we're more served with finding a solution than with placing the blame.
Hmm.
But if there's anyone to blame for me, it's not the patient, because the
No.
patient doesn't have this information. I have this information because it's my job, but a regular person doesn't have this information. So, and then for the second part, they don't have the information, so they cannot make the right decision. And the second part is that society is actually shoving us in the wrong direction with all the marketing of non-functional foods, for example, and with the evolution of our technology, which makes us sit in the couch more often instead of going outside to do stuff. So I think there's society is more to blame than a person in particular.
Yeah, that makes a lot of sense. Yeah.
Mhm.
So you and I have both completed a healthy lifestyle challenge called Wildfit, and we both liked it so much that we're now in the process of getting certified to be able to coach our patients and clients through the
Mhm.
process of making long-term changes to their lifestyles. So how do you explain Wildfit to your patients?
Now that's a difficult question. No, WildFit is returning to our human diet, returning to the way we are supposed to eat. So it contains a lot of information on what is functional and on nutrition and what we can learn about this from history, most of all from our ancestors. On the other hand, it's a powerful food psychology program as well. It makes you rethink the way you behave around food, why you choose a certain food. And because of that awareness, you can make better decisions for yourself. And if you make better decisions, then you will feel better. And I have no doubt about it. I myself, for me, weight loss was definitely not a reason to do the program. but I saw a lot of other health benefits, like my skin, and my nail quality, for example, my energy, definitely. I'm a working mom of 3 kids. I need a lot of energy, and Wildfit definitely helped me with that. My focus as well. So there's a lot of improvements that can be made, and I think it can be very, very powerful for cancer patients through their recovery process to get in touch with their human diet, to become aware of the way they think about food and their relationship with food. It can really improve their recovery and make them healthier, maybe even healthier than they were before they had cancer.
Amazing. And one of the coaching strategies that we use in the Wildfit program is to help people identify what we call the 6 types of hunger, which are the types of hunger that influence our eating patterns. Do you feel like you could give like a quick explanation of some of those hungers and maybe how like the role that they play in people's lifestyle?
Okay, so the 6 hungers goes back to the reasons why we decide to go and eat. The first one is thirst. We should always be hydrated, otherwise we feel hungry, but it's actually a signal of thirst. Nutritional hunger is the base hunger. That's the one we have when we're lacking a certain nutrient. So that's a very basic hunger. That one we should have. We should keep. It's a good one. Variety hunger, because we all want variety in our food. We don't want to eat the same food every day, even though maybe so many thousand years ago, if there was only fruit, you would be eating fruit. But we want variety. We always want different stuff on our plate. We don't want just one thing on our plate. There's emotional hunger, which is probably the biggest driver for us to eat nowadays, because that we are having enough food. We don't live in lack like we used to. So emotional hunger is definitely a big driver. And like I said, for cancer patients, I think there's a lot of things going on there. Like I survived this, now I am allowed to have this. Low blood sugar hunger is another one. So when your blood sugar is low, you want to survive, so you have to eat. And an empty stomach hunger. So when your stomach is empty and it's growling, then you feel like you have to eat, but maybe you don't have to. It's just an empty stomach and not more than that. So those are the different types of hunger that we play with, and becoming aware of what you are feeling and why you're going towards food might tell you, like, is this really necessary? Maybe I'm just thirsty. Maybe I just need to drink and I don't need to eat right now. So there's a lot of powerful ideas when you start thinking about these hungers.
Yeah. And one of the things that I really like about the program is how easy it becomes to satisfy the nutritional hunger and the thirst hunger and even the hunger for variety, so that then it becomes so much easier to notice when you're hungry for emotional reasons or having the blood sugar hunger. And or the empty stomach feeling, and it becomes much easier to handle those when your real nutritional hunger and hunger for thirst are taken care of. Thanks for that little summary. Is there anything else that maybe you would like to share that is especially useful to people who are in remission, for example?
I think when you are in remission and you took the effort and you went through all that you have to go through to cure from cancer. So yeah, you had to go through a lot of treatments that were harsh, that were difficult. You owe it to yourself to take good care of yourself and improve the way you recover and improve your quality of life, so that you can really enjoy the life that you have gained back by beating cancer. So there's a lot to be said to really dig deep and change your lifestyle and for the better, so you can have good quality of life and continuing your life and enjoying your life more as a reward for having won the fight against cancer. Definitely.
Beautiful. You just said it so nicely, and I'm so touched. That's exactly what I want to be able to do, is to make it easy for people to do just that.
Mhm.
Thank you, Anka, so much for this interview. And thank you, everyone who's been listening. I hope you have found it insightful and inspiring. And we'd love to hear from anyone that's watched this interview. Thank you.
Thank you.